Whether you're trying to get pregnant today or you are avoiding pregnancy after doing one or twos, or you just want to even understand your body perfect, knowing ovulation as a woman is the key. I've embedded timestamp in this video for easy navigation about ovulation, because by the end of this video, you'll understand and learn what ovulation is, why is it important, what are the signs that you're ovulating, and lastly, how to calculate your ovulation period. So if you're new to the channel, kindly like and subscribe for more content on women and child health. Okay, so what is ovulation? In simple terms, ovulation is the release of mature eggs from one of your ovaries, which usually happens every menstrual cycle. Think of your ovaries as a crate of an egg with thousands of eggs. Each month, about 6 to 12 starts to mature, but usually only one becomes dominant and is released. The egg then travels down to the fallopian tubes where it can be fertilized by the sperm. So why is ovulation so important? I will give you three. The first one is for conception. When you and your partner want to make a baby today, ovulation is the main event that both of you must attend. An egg can only be fertilized within 12 to 24 hours after being released. So knowing when you ovulate helps to identify your most fertile days. Secondly, knowing when you ovulate serves as your natural family planning. For some of you that do not want to make use of other contraceptive methods or family planning methods out there, like use of condoms for reason best known to you, I don't want to get into there, or other contraceptive medication because of the side effects of getting fat and the rest, resolving to timing your ovulation will serve as a natural family planning for you. Although you have to stick till the end of the video to know how to calculate your ovulation period so as to maximize and reduce the risk of an error. Thirdly, knowing about your ovulation helps you to understand your cycle. You see, it's not all about trying to get pregnant or trying to avoid pregnancy. Rather, knowing about ovulation helps you as a woman to understand your reproductive health, because it's a signal that your reproductive hormones, your female sexual hormones, are actually working appropriately. Because irregular or absent ovulation can sometimes be a sign that there's an underlying health issue that might need an attention. So the knowledge of ovulation will help you to understand how your reproductive cycle is, how is your reproductive hormone responding at appropriate time of the month. So after knowing the importance of ovulation, the best question will be, what are the signs that yes, my ovulatory period is close by, or I am even currently ovulating, right? We get a lot of this question, but just like your phone sends notification when your man's promised to send money and he eventually sends it, your body also sends this clues when you are about to ovulate or when you're even ovulating, just that you don't pay attention to these clues. Here are some of the signs that your body is trying to let you know that you're about to ovulate or you're even ovulating. Number one, increase sexual drive. It's not all part of the months that your sexual drive is high or low, but when your body is about to ovulate, some days prior to your ovulatory period, you find an increased urge for sex. This is only to stimulate you to have sexual intercourse, whereby sperm actually lasts for maximum 5 days. So days prior to your ovulatory, you will have high sexual urge and might demand for sex during those periods for fertilization. Secondly, you will experience breast tenderness, whereby some women complain that they feel the breast is full and it's a little bit painful. This is because of the hormonal surge that happens prior to ovulation. Thirdly, you might experience an increased sense of taste or smell, whereby you feel like you could smell everything, or your sense of smell is actually heightened prior to ovulation. The fourth is the least ignored, though the most reliable changes you will feel while you are about to ovulate or when you're ovulating, which is the changes in your cervical mucus. As you approach ovulation or while ovulating, you will discover that your vaginal discharges typically become clearer, more slippery and stretcher like a raw egg white. This cervical mucus helps sperm to swim and also survive. You might notice that when you go to the bathroom or on your underwears when you're trying to change them. A lot of you do not pay close attention to such changes, or maybe feel like, okay, they are just secretions. No, you have to pay very close attention to those changes, because it's indicating to you that, okay, you are about to ovulate, or you are even currently even ovulating. The fifth change that you will notice while ovulating is a rise in your basal body temperature. Your basal body temperature is the temperature of your body while fully at rest. And research has shown that while ovulating, it is slightly elevated to about 0.2 to 0.5 degrees Celsius changes, and it stays elevated until your next period. How to track this is you will need a basal thermometer where you take your temperature first thing in the morning before you get out of your bed, and chart this daily, because this is going to help you to see the pattern and confirm the changes while ovulating. The sixth changes is what the German call the Mittelschmerz, or the ovulation pain. Some women feel a slight twitch or mild cramp in one side of their lower abdomen when they ovulate, and that is what they call the Mittelschmerz, which in German means middle pain. It can last for a few minutes or a couple of days. It's usually not severe but noticeable if you pay attention to the changes in your body. I know some of you pay attention to this, although most do not. Remember, not every woman will experience all of this and in this succession, but you will be able to experience at least one or two of these signs. But the main thing is to identify and pay attention to those clues that the body is giving about ovulation. All right. Now that you've learned the signs that indicate that you are almost about to ovulate, or you are even currently ovulating, it is very important to calculate your ovulatory period. Aside from the physical signs, there are other ways that you could use to predict when you're going to ovulate. And the most common method that is being used is the calendar method. I will show you how it works. Look, if you have a regular menstrual cycle of 28 days, ovulation will usually occur around the 14 days before your next period starts. And these are the steps you need to take in order to accurately calculate your ovulatory period. Step 1 is for you to be able to track your menstrual cycle for a few months and calculate the days of your menstrual cycle. And how to calculate the length of your menstrual cycle is for you to count from day 1 of your period to day 1 of your next period. In step 2, let's say for instance, the cycle is consistent for about 28 days long, right? So subtract 14 from the 28 days, which give you 14. So you're likely to ovulate around day 14 of your cycle. That's if you have a normal menstrual cycle of 28 days. But what if you have, for instance, now your menstrual cycle length is 30? The same rule is going to apply, whereby you subtract 14 from your menstrual cycle, which is 30, which is going to give you 16. So for your own case, you are likely to ovulate around day 16. An important thing to take note while using the calendar method is that this method is less reliable if your cycle is irregular, whereby it is not consistent, whereby this month you have 26, the next month you have 28, the next month you have 30. This method is less reliable and it can get you an estimation, but the fertile window can be wider. What I mean, sperm can live in the reproductive tract for up to 5 days. So your fertile window is typically 5 days before ovulation plus the day of ovulation. The second method that you could use to estimate your ovulation period is the ovulation predictor kits. These kits are available at many pharmacies around the world, and they aim to detect the hormone for ovulation, which is the luteinizing hormone in your urine. So this luteinizing hormone surge happens about 24 to 36 hours before ovulation. And how to use this is you will typically start testing your urine few days before you expect to ovulate. A positive test indicates that ovulation is likely to occur soon, making it good time for intercourse if you're trying to conceive. And if you're trying to avoid pregnancy, that is your fertile days, so you will have to kind of abstain or use protection during that time. So the benefit of this is they are quite accurate in estimating the luteinizing hormone level, which is increased prior to ovulation. And if you're having a painful menstrual cycle, chances are you are not avoiding the 10 harmful practices that is affecting about 750,000 women worldwide. Check out this video in my channel for more information. If you find this video helpful, do well to like and don't forget to subscribe. And if you have any question, kindly drop it in the comment section below and I will do my level best to answer. Until next time, stay healthy and stay informed.